Hi, I'm Magnus, and today I would like to talk about hormone replacement therapy or HRT. But first of all, holy hells, 200 plus subscribers? Wow, that's 170 plus more people that I thought that will follow me. Uh, Thank you very much. I never thought it could happen, really, because the channel is LGBT plus, educational, and doesn't have that many videos. So, thank you very much, and for everyone that subscribed, and I hope the information helps you. And now, on to the topic. HRT, as is commonly known, is an option for medical transition. Depending on you, and it can, depending on your needs, it can promote physical changes by lessening or increasing testosterone and estrogen. The treatment, while common, it is not necessary to transition. Because of my transition, I have more experience and knowledge of testosterone. I will leave on the description some links about estrogen HRT. So, to start HRT, you usually have to be either 18, 21, or older, or have your parents or legal guardian's permission. When you start young, around 10 to 15 years of age, you have the option of hormone blockers. Unfortunately, this is not available in all countries. As the name suggests, it helps stop the hormonal changes common in preteens, helping to avoid uh, the events such as voice dropping, monthly bleedings, among others which can be quite painful, and detrimental to transgender people. These are not harmful, and if so desired, you can stop them and letting the hormonal changes occur as if nothing had happened. Now, for HRT, if it's covered by an insurance, public or private, you will most probably have to follow a series of steps. It's common to start with a general doctor or a primary care physician, PCP, who will refer you to a psychologist, who will refer you to an endocrinologist. Usually, the psychological evaluation seeks to quantify your transness using your existent or non existent dysphoria, since it's a common element in transgender people. Just remember that the dysphoria is not necessary to be trans, and the counseling can help you solve any questions or concerns you might have. You can search for LGBT friendly doctors or the closest gender clinic. Just remember that the process can be quite long and drawn out. With the endocrinologist, you'll go through a set of tests to check on your health, as in your kidney, liver, heart levels, blood count, family and health history, etc. This is done to assess your overall health and determine the best way to go with your HRT. Because while HRT is not harmful, it is medicine. That, for example, testosterone is processed by your liver, so it must be in good condition. Testosterone can also change your blood count, making you at a higher risk of a heart attack. Cisgender men are, after all, more prone than cisgender women to heart attacks. So, if you have high blood pressure or fatty liver, etc., it's best for your doctor to know so they can follow your transition as needed. Now, if you don't have a coverage, you can skip the general doctor and the psychologist, but you must follow with an endocrinologist. Because the problem with self-medication is you can easily under or overdose. And if, for example, you overdose testosterone or T, it can convert into estrogen and give you a monthly bleeding that you don't know why. For the treatment itself, it's there's a gel, injection, and a nasal spray. There is pills, but they're not used because the side effects that they have. That's sorry, only for testosterone. Again, I I only have experience with testosterone, not with estrogen. Gel is usually put daily in arms, thighs, or stomach. You don't put it on your face or genitals because it's alcohol based. Injections are usually done every 3 to 6 months in thighs or butt cheeks. Nasal spray is not common, and I don't have much knowledge about it. Probably done 1 to 3 times a day. Gel is good because it doesn't require a needle, and the progress is smooth. The intake remains the same, but the changes tend to take longer. Like the changes are slower at they're noticeable at the third month. Injections are quite painful. The progress is irregular because it has peaks on injection day, lowering down after. But the results are noticeable at the faster at the first month, and unlike gel, it doesn't need daily reminders. And in any way, you will have to follow up with your doctor every 3 to 6 months to for the first doses. Some side effects of HRT um, generally can be acne, loss or gain of weight, migraines, diarrhea, nausea, etc. But they usually go away after the second or third month of usage. A very important recommendation, um, no matter your transition, is to continue with preventive checkups, such as the breast cancer, cervical cancer, prostate cancer, etc. Top surgery doesn't remove all tissue, and even with low T levels, you can still get cancer. As another recommendation, testosterone can lower down your ovulation and disappear your monthly bleeding, but it's not a contraceptive. So, if you don't plan on being a parent, use a condom and follow all precautions. If you have any questions or concerns, you can always ask. There's also groups, pages, and others who give counseling, guidance, and experience. So, if you like, you can comment below. I'll be making another video as a preparation for tea. For preparation for tea. Well, I hope the information was useful, and as always, I hope that it was useful. Thank you very much for the subscribing. Bye.